a breast lift or mastopexy comes in 3 different forms. There is a circumvertical, a periareolar, and a Weiss pattern. So let's kind of break all these down. So if we talk about a periareolar mastopexy or periareolar lift, some people call it a donut lift, it is good for lifting and moving nipples less than 2 centimeters. So if your nipples are a little bit too low, you may be a candidate for a donut or periareolar mastopexy, which only is able to move the nipples up about 2 centimeters max. And the final scar is a circle around the areola. So essentially an incision is made around the areola, and then another incision is made in another circle, which is a larger circle, and the skin in between is shaved off. And when the big circle is sewn to the small circle, we can lift your nipples up to 2 centimeters. That's about the extent of what's possible with a donut lift or periareolar mastopexy. If you need more than that, we may need to move on to the circumvertical or lollipop mastopexy. This is able to move the nipples a much further distance up. It's also able to tighten up the breast or tighten up the loose skin envelope of the breast more than a periareolar or donut lift is able to do. And the final scar of a circumvertical mastopexy is a lollipop. There's a scar around the areola and a vertical scar down the center or meridian of the breast. And finally, the most powerful breast lift is the Weiss pattern mastopexy, which leaves an anchor-shaped scar. So this, version of the mastopexy has the ability to reduce the breast soft tissue envelope in all dimensions. So we can move the nipple up where it needs to be. We can get rid of the extra skin in the horizontal and vertical dimensions. And it leaves an anchor-shaped scar. Now, the difference between whether you need a lollipop or circumvertical mastopexy and a Weiss pattern or anchor mastopexy depends on your vertical excess. Meaning, once the nipples are up at the level they're supposed to be, what will be the final distance from your nipple down to your fold? And if that distance is going to be too long, you need the full anchor or Weiss pattern mastopexy. If that distance from your future nipple position to the bottom of your breast is normal based on your body, which is all based on measurements, then you may just need a lollipop or circumvertical mastopexy. But those are the 3 different variations of mastopexy, and it all depends on your breast dimensions, how much extra skin you have, and how far the nipple needs to move. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.